Thank y'all for coming this morning. I appreciate y'all coming out on a Saturday morning. It's always hard to get moving. But this is a lecture, as you can see, about why you're not your diagnosis. But before I get started, I'd really like to introduce my partner in my medicine practice now, Jody Westfall. She specializes. Come stand up. Oh no, you got to come stay all the way up. So Jody is seeing patients with me. She's specializing in dermatology, women's health, prenatal counseling. Some of the next lecture we're working on is going to be really on why the first 6 months before people, both the male and the female, even get pregnant, why it's important. That's actually the most essential time to be looking at supplementation, genetics, and these sort of things. And so she's going to be doing that, but she's going to really be so integral in our practice in the future, and I really would avail you to take advantage of her skills both in dermatology, women's health, and the ability to pull everything together like I do. So she's bringing much needed help to our practice. So just wanted to welcome her. Okay. So, I think this is probably one of my favorite lectures to put together, because this is my thing that really drives me crazy, is that we really, as physicians, it's so important that we give you a label, okay? And I think this has even deeper philosophical things. We need to label people so we can say, you can do this and they're going to do that, and we know, and we create these boxes, and in those boxes we know how to understand things. We don't have to go outside of our comfort zone. So when we're talking about this, we're really talking about human nature, okay? So when we're talking about you're not your diagnosis, we're talking about why, and that's one of the first hour is really going to be focused on the why diagnosis is important. And I think it's important to understand the philosophy of this, because when we understand the why, that empowers us to understand how to break free of these things that we call diagnosis. So, in medicine, and just to give you a short, we're going to do about 40 minutes, take a 20-minute break, another 40 minutes, a 20-minute break, and then the last hour, I'm going to do about a 10-minute talk, and then we're going to do question and answers. And I think the question and answers is sometimes one of the better parts of my lectures. And so there'll be index cards at the back for that. So please write those down. So when we talk about what are the diagnoses we're talking about, and why is it important to create labels? Because basically that's what we're doing, right? We're creating labels. I'm a Lyme patient. I am an autism patient. I am a diabetic patient. I am a fibromyalgia patient. I'm a chronic fatigue. And I always urge people, you are not these labels. You are a patient who has symptoms of Lyme, of fibromyalgia, of arthritis. But you are, number one and foremost, a patient. And these are symptoms, are manifestations of inflammation. But this is a label we have put on it, but it's not inevitable. And it is not what has to define you. You do not have to stay on this pathway, because these pathways are highly dynamic. And there's a lot of people. I saw a lady that was told, actually, she should not have been sitting in my office. She should have been dead a year ago, according to her oncologist, because she had been diagnosed as an inflammatory breast cancer patient. And I said, she did not accept that label. She did not want to be an inflammatory breast cancer patient. She wanted to be a patient that also had inflammatory breast cancer. Well, guess what? She is in full remission. She has she has done the things she needed to do to put her cancer into remission. And that's because she didn't accept that label. So that's why it's so important that we don't accept labels. It's so important that we don't become the diagnosis that we've been given. So why is a diagnosis important? Because all of a sudden, doctors have this. okay? This is an algorithm. And if you can read it in this short order, I'd be very impressed. But this is very complicated, right? But it gives a doctor, okay, so here's our hemoglobin A1C. It's less than 7.5. What do I do? Well, I can use metformin, GLP-1s, DPIs, go down the list. Oh, wait a minute. They're getting their hemoglobin A1C greater than 7.5. Well, I can use these medicines. Oh, wait a minute. We've got to go over here. The hemoglobin A1C is greater than 9. Dual therapy. We can go symptoms. No, we'll just go dual therapy. Symptoms, yes. Oh, we got to add insulin. You can kind of see this is what happens when you become a diagnosis. You become no thinking required. Okay? All of a sudden, my job gets easy. All right? So all I have to do is say, well, Mrs. Jones, you've got a hemoglobin A1C greater than 7.5. You're going to have to do dual therapy. We're going to use these drugs. And if those don't work, then I'm going to go back and I'm going to do these drugs. And then if you get to here, I'm going to do insulin. And, oh by the way, eat well and exercise. That'd be, what does that mean really? I don't know, but I'm supposed to tell you. Eat better and exercise. Well, does that really help Mrs. Jones? It's Mrs. Jones, she's now become a diabetic in the system. And so with this diagnosis of diabetes, the system is going to do real well, all right? The only person that's not going to do well is Mrs. Jones. And you need to understand that. And I'll explain to you the time constraints and why, if you understand the dynamic, you understand that there's no evil plot. It's just what we've accepted as patients and as a society is that, oh, I've got diabetes. It was inevitable, and I've got to do these medicines. I can keep eating whatever I want to, and I don't really have to exercise. My doctor says it, but he doesn't really mean it, and he doesn't because he doesn't think he thinks this is a long-term issue. So if we want to get away from thinking medicine, algorithms are really, really helpful, right? Because now, as soon as I've got that diagnosis, I can bring you in, say you're on this medicine, we'll add a third medicine, we'll follow you up in 3 months, we'll get these labs before you come back. And I did this for 8 years. I know what the drill is. So I'll do these things for 3 months. And then we'll see you back, and your hemoglobin A1C dropped 1 point. I feel good because, yes, I'm helping Mrs. Jones. But am I? We show that in diabetes that often these things, follow these algorithms, don't help long-term mortality. People die the same amount of time if we let their sugar go wild sometimes. And there's some real interesting data on that, especially when you add insulin. So what are we doing it for? If we're not trying to change disease, what are we doing it for? And that's a good question. You got to ask yourself that. Why does diagnosis matter? Because when you have a diagnosis, all of a sudden, guess who benefits? Everybody that helps make that diagnosis. We've got to do your test. We've got to do this now. Oh, you're diabetic, or diabetes is just the one I'm using right now, but diabetes, we've got to do this test this many times a year. We've got to do this. We've got to do, now we've got to increase your screening exams. And so all of a sudden, and it's not that there was it's just why change a system that benefits everybody but the patient? Why? There really is no impetus to change it. So, we've got to do, because we've got to do colonoscopies more frequently, or you pick the procedure. We got to do heart catheterizations. And these are just to tell you that procedures, because we've got this algorithm now, procedures play a role. So when you get this diagnosis, all of a sudden, the procedures such as a heart catheterization, $12 billion was spent last year on heart catheterizations. And I'll explain a little bit more about that. But all of a sudden, diabetics are a lot more likely to get stress tests because they do have increased risk of heart disease. And so with increased risk of heart disease because their diabetes is not being controlled, now we've got open heart surgery. And once again, lots of money is being made on that diagnosis instead of getting to the root cause. We get labs. We get labs very frequently now. Once we've got a diagnosis, we have to be in standard of care, get labs ever so often. Labs become really important. And most importantly, when we got that diagnosis, that high-powered $200 a month medicine becomes justifiable, okay? So if I get you feeling better, I get you to exercise and eat correctly and understand the reasons for your disease, you're not making anybody any money anymore. Okay, guys, let me just be honest. We give lip service to, we want you to be healthy. We want to do preventative care, but nobody really has the incentive, and not because of lack of desire. These doctors, 99% of them are altruistic. They do want you to do well. They have every intention of you doing well, but they don't know, they've bought into the system of, okay, so, and I'll explain a little bit more why that's happened, but you have to understand that you as a healthy individual do not benefit it's like the healthcare industry is huge. I mean, huge. $100 billion was spent just on heart care last year. $100 billion. Do you think those people are going to say, really? I mean, they're still teaching 30 years ago what they said, low fat, high carb, and that's happened a couple months ago. I talked to somebody, said, you know what they told me? They said to feed my husband low fat and high carb. And I'm like, the research is 30 years ahead of that. 30 years it's saying that is not the way to eat. And we're now, and Mark Hyman, one of my colleagues and someone I look up to greatly, has estimated that if we addressed people and not diagnosis, if we looked at the root causes, 80% of hospitals would shut down. 80%, and I believe that. I believe that most of our healthcare dollars is being spent on chronic care. So, you know, when you look at medicines, pharmaceutical companies, we know now that, you know, that's one of the larger costs, and they're going up, even though everybody's upset. So the best way to get around the pharmaceutical companies is to take care of yourself and not need these things. But this is what algorithms do. This is what diagnoses do. You know, because I have this diagnosis of fibromyalgia, we've got this new drug, and the insurance company will pay for it. And ultimately, the insurance company may pay $1,000 a month. But who is the insurance company? The insurance company is actually you. And you say, well, my employer's paying it. Well, you're not making as much of a living wage because your employer is having to spend an extraordinary amount on your health care. So it's really coming out of your pocket. So we're all, as a society, really, this is about everybody helping everybody by not being a diagnosis. Because when you become a diagnosis, you become dependent upon all the things I mentioned, the labs, the radiology, and the medicines. You know, and I mentioned the heart catheterizations. And the thing about it, this is interesting, heart catheterizations, cabbages, stents, that's about a $50 billion to $100 billion a year industry by some estimates. Okay, the industry is. Do you know that there are studies that show that Dean Ornish did this, he did a true dietary changes with people, and he had the same success rate or greater success rate by changing people's diet than by giving catheterization. One costs less than, probably to educate all the would be less than 10 millions, and the other is in the 50 billion range. But are we taking that data and saying, hey, why aren't we teaching people how to eat right? Why aren't we taking cancer patients when they finish therapy and teaching them that if you eat correctly, if you do these things, your cancer won't reoccur? Once we get them in remission, we say, that's fine. We'll see you back. We'll keep screening you. We'll keep doing colonoscopies. We'll keep doing chest CTs. But nobody's talking to them. The best way to prevent cancer is to eat right. The best way is to avoid sugar. What drives cancer? Sugar, inflammation, toxins. But nobody's talking about that because ultimately there's no impetus, there's no reward to anyone but the patient when we do these things. So the thing is, we'll bring you back and we'll keep screening you until your cancer reoccurs, or we'll keep our fingers crossed that it doesn't happen. And they don't want to see you again, but yet they haven't really given you any tools not to show back up. So the system stays in place because everybody is benefiting but the patient with that diagnosis of, oh, I'm a breast cancer patient. No, you're a patient who had breast cancer, but you're not a breast cancer. You can't live that. You have to understand that you're empowered and that you're not that diagnosis. And this is what it boils down to. The money that is made is tremendous. And there's no impetus in society to change that because so many people are benefiting. It's just what it is. And let's talk about briefly why diagnosis matters. And I want y'all to understand this because I think about these things a lot. And so I'm going to go through a little financial lesson with you to show that your primary care doctor is usually really means well. He means, he really wants to do the right thing. And all the primary care doctors that I know are really good people. They didn't go into it because they could have gone into a specialist or whatever and made a lot more money and had a lot more prestige as such. So these guys really care. But let's take a look. Okay, so this is what happens in the insurance model. If you're lucky, you're going to make $80 per visit. Okay, I gave the normal overhead per patient between the nursing, the pre-authorizations, all the things that it takes to run an office manager, insurance, a biller, overhead, that's at 65%. Actually, most doctors are pushing 70% of their overhead. So out of that, the net profit per patient per visit is $28 to that doctor, at best. Okay? That's a best case scenario. So we've got $28 per patient. What are we going to do? Okay, so this is annual salary now, and I'm not saying this is a bad annual salary, but this is what, when people get hired on to hospitals and they get, this is what they make. This is the average as a primary care physician. It's around $190,000. By any stretch, that's fantastic, I understand. Monthly salary, it's around $15,833. So the daily salary, I broke it down, and I took out vacation days, 4 weeks of vacation, 1 week of continuing medical education. This is what needs to be seen in a day, okay? If you want to meet those numbers, you have to see 30 patients a day, okay? So you can kind of follow the math. I wanted y'all to see why a diagnosis helps with this math. Okay, so average hours in the office, 6.5. I'm being generous. Again, a lot of doctors spend 6 hours in the office. 6.5, probably about right. Average minutes, so I took 6.5, multiplied it by 6, and I took 30 patients. This is time per patient, no potty breaks, no taking time to smell the roses, no time to spend a little extra time and tell Mrs. Jones you're sorry to hear about Mr. Jones who passed away. No time to really get to know people. You've got 13 minutes by the time you hit the door to make a diagnosis, to give them their scripts, get them set up, and that's 13 minutes, and you're walking into the next door. Okay? So this is what we're looking at. Doctors have debts, a lot of debt coming out of school. They have all these things, and they need to make a certain amount of money just to pay back those debts. They have their own obligations they have to do. And so the insurance model is primary care, if they were a specialist, they would get double this amount. Okay? Specialists get paid a lot better, but the person that's on the front line is the primary care doctor. This is the one that is time constrained. So what does a doctor do? Okay, let's say he walks in that 13 minutes and you're trying to tell him your story, and it's complicated because most stories are complicated. It's not as simple as I fell, I twisted my ankle, the bone is sticking out. Oh, you have a fracture of your leg. We need to do this. It's very rarely that simple. So, I just don't feel right. I've been more tired and so forth. So he's not able to get the history of, well, I just moved into a new apartment. Oh, it had water damage, so forth. And all of a sudden, we talk, and and I also went camping and these sort of things. So we don't pull in that maybe you're being exposed to mold, and maybe you've been bit by a tick or you name it. But instead, you've got symptoms. Well, it sounds like you got chronic fatigue, Mrs. Jones. So, Mrs. Jones, I tell you what I'm going to do. I'm going to send you to the rheumatologist because I need more lab tests. And we're going to do these tests before I send you. And he'll probably order more tests. But we'll order these tests, and we will send you to the specialist. And then, you're complaining of a headache with this, which is common when you're exposed to mold. But he doesn't know it's mold. He said, so we'll get a CT scan, make sure you don't have a tumor, okay? Because he's got 13 minutes to make this decision. He's got 13 minutes to understand what's going on. And though, what does the specialist do? We get more procedures, we get more labs, we get more meds, more imaging. So you can see that this need for a diagnosis becomes important, because once we get that diagnosis, now our 13 minutes are, so Mrs. Jones, how are your meds working? What are your meds doing? Okay, well, we'll change it to this med. Well, this new high-powered med just came out. We'll do that, because now I don't have to think anymore. I've got a diagnosis. And with that diagnosis comes an algorithm, okay? So when you got the diagnosis, now I've got an algorithm. With fibromyalgia, okay, this is not working. We'll try Cymbalta, or we'll try Savella, or we'll try some new drug that's available. We're not going to have time to talk about your diet, what role that's playing. We're not going to be able to talk about your environment, what may be the root cause of why you have these symptoms. Okay, so now, but the doctor is relieved because, okay, I sent it to the rheumatologist. He's given me a diagnosis. I don't have to worry about missing anything. I'm covered. Malpractice is taken care of, and I can see my next patient in that 13-minute window. It's not his fault. It's just the nature of what we reward in this society. We don't reward time, okay? That's what it comes down to. We don't reward doctors for being doctors or being creative anymore. We reward them for to get you through the door, you know, sinus infections. Okay, you've got another sinus infection, Mr. Jones. Here's your antibiotics. I'll see you in 2 months with your next one. You know, how often that happened, and it used to drive me crazy. Now, I can tell people, stop eating this, this is what's going on, this is why you're having it, and I don't see them for 3 years. Well, you say, well, that's not a good business model because you really need that $80. No, I don't. Because I'm actually got other people that need to come in and see. So I've taken that patient and they no longer are coming in for a $100 antibiotic every 2 months because they were able to change their environment. We've got to think about these things differently and quit seeing myself, oh, I get sinuses every year. I'm an allergy patient. And you just accept it. In the spring, I just get allergies. Well, stop eating dairy. Amazingly, most people's goes away if they change their diet. But all of a sudden, the 5 medicines I was on for allergies went away. That doesn't benefit anybody but me. I'm no longer spending $200 or $300 a month on allergy meds. This is my own story. You know, changing my diet made a huge difference. But it doesn't keep me going back to the doctor, and so society sometimes, we need to start valuing it, and we are. As patients, we're changing it. So algorithms, as I've shown you, are very important. And so with a diagnosis as an avalanche, I've been talking about this. You have more drugs, more labs for monitoring. You need more frequent visits because it is only manageable and not treatable, guys. Okay, you've got fibromyalgia. We've got this diagnosis now. You're stuck with it for life. My patients are told that all the time. This is just who you are. This is what you're going to be. This is how you've got to learn to live with it. Accept it. And I tell you, no, do not accept anything. You can change it. So that's not the message we're getting as patients, but it's the message I want you to hear today. Specialists are involved. Specialists are great. They're really, they've trained, they've done, but most of the stuff that specialists take care of can be taken care of by you, okay? And it becomes expensive when you see a specialist because then they have the ultra burden of, let's make sure I don't miss anything. So they order extreme amounts of tests, extreme amounts of procedures, and they don't get to the root cause, but we ruled out everything else. I don't have to worry about malpractice, and you'll be on this medicine the rest of your life. We'll see you in 6 months. Hospitals are utilized. Hospitals are a major industry, guys. They make a lot of money, lots and lots. And that's why they're building them like wildfire. You see consolidations, and you see more hospitals going up because it is important to, and you make a lot of money when somebody gets sick. And my question becomes, instead of waiting for somebody to get pneumonia or waiting to get heart disease, if you head them off at the past 20 years earlier, and I'll show you the math behind that, then all of a sudden these guys aren't really benefiting. So they're not going to push true preventative care, guys. They are not going to get to the root cause of problems. They're going to say, come in for your mammogram, cha-ching, come in and get your pap smear, come in and get these things we can send to our pathology lab, but they're really not talking to you how to prevent breast cancer. Do you know a self-breast exam is more accurate and picks up on breast cancer 1 to 2 years before a mammogram does? Self-breast exam. So why aren't we telling people when you drink a 20-ounce pop, you're really increasing your risk of breast cancer? Why aren't we telling them that the foods they're eating, why aren't we truly taking, if we want to spend, I won't even hardly get into the breast cancer prevention things, but, the pink ribbon thing, I think it's some estimates 80 to 90% is spent on overhead, 10% is spent on research. And we're giving it a lot of lip service, but we're really not talking about the root causes of things like cancer, because everybody benefits but the patient. Algorithms are now the replacement for thought processes. I mean, this is, if you get anything from me, is that, medicine has become, and that's why I left traditional medicine 7 years ago, because I said, an organ grinder with a monkey could do what I was doing at that point, because I was just going through algorithms. I went to take my family practice boards, and all of a sudden I realized all I was being tested on was algorithms. And I was like, why do I need to know algorithms? I kept going, but if they're on steroid, okay, if they're having 2 asthma attacks per week, I'm supposed to put them on this drug. But if they have 3, they go into this other category, and then I've got to put them on these 2 medicines along with this medicine. But if they're getting 4, then they need to go into this category. I'm like, why don't I figure out why they're having asthma? I was like, holy crap, I don't have to go through these algorithms anymore, because I know now that I don't have to think of them as an asthma patient. I have to see why they're getting asthma. I figure that out, and holy cow, they don't need any medicines at all. But we're not looking at that, because algorithms have become the replacement for thought. So who benefits? I've said this. The money's coming from you. One way or another, it's coming from you. And the great thing about Dr. Google, which is what I like to call the internet now, is that y'all are getting empowered as patients. Congratulations and good job, because y'all are going to change the face of medicine. And it's going to be because of you that we cannot keep doing things the way we've been doing it. Y'all are empowered, y'all can read, you can understand, and y'all are no longer in the patriarchal of, we've got the answers, follow us, do what we say, it's going to be all right. That's over. We don't know it as a medical profession yet, but I tell y'all, I have seen it, and it is over. And the thing that's going to drive it is you, and knowledge and empowerment. And that's the thing I tell my patients. Please read. If I don't know about it, great, teach me. We'll learn together. But the more empowered you are, and you can't read everything and believe everything on the internet, but at least get the thought processes going, because ultimately nobody is going to really take this ball and run with it except you, because there's too many people benefiting from you and your dollar, okay? And the more you're in the dark, the more they benefit, because, and it's not like it's a big conspiracy, it's just because it's comfortable for everybody. Oh, well, we're making this, we're doing catheterizations, blah, 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 and it's comfortable for everybody, except you as the patient, because now our living wage is dropping, because now our health insurance dollars are increasing, because we're not being healthy, and we're not being told that's the way that we need to practice. This is what we're to believe. Disease is inevitable, okay? Disease, it's just the way it is, Doc. My mother had diabetes, my grandmother had diabetes, and I'm like, or, Alzheimer's runs in my family. It's just what I've got to live with. And disease being inevitable is good for everybody but you. Again, disease is inevitable. Eat what you want. Sleep as little as you want. Don't exercise. You're going to get it anyway. Okay? Just go ahead and enjoy the ride, because there's nothing you can do about it. And I'm here to tell you, the thing is, well, it's in my genetics. That drives me nuts. It's in my genetics. My genetics say I'm going to get this. Yes, you have some predispositions through your genetics. And when you have these predispositions, what does that mean? The big gene is the BRCA gene. I've got the BRCA gene. Angelina Jolie had bilateral mastectomy because she had the BRCA gene. And that may be the right decision for her, because 87% of women with this gene end up getting breast cancer. What did they get 50 years ago? What was the predictive value 50 years ago for that gene? Same gene. Genes didn't change in 50 years. It was 27%. So you're looking at genes are not inevitable. Genes are very much driven by what we eat, by our environment. So what changed in that 50 years? And I have graphs in previous lectures I've given that showed our consumption of sugar, our exposure to chemicals. Our consumption of sugar went from 30 to 40 pounds, which is a lot of sugar, to almost 150 pounds of sugar a year in processed food. In those 50 years, nobody's looking at that. Our exposures to toxic chemicals, to all the things we're putting in our environment has doubled. I mean, the baby, when it comes from the mama, has over 100 different chemicals in the umbilical cord now that it's being exposed to. So what's changed? Our environment's changed. What's another thing that's changed? We're not sleeping as much, and I'll have a slide later that shows that. So when we think of genetics, we need to understand that DNA is not our destiny. It's called epigenetics. What we eat, how much we sleep, how much we avoid toxins, eat organic foods. These things are giving direct information to our genes and preventing Alzheimer's disease and preventing diabetes. So we know that what we eat changes our genes, and we know that how much we sleep changes our genes. We know that meditation, we know for a fact that meditation and reducing stress changes our genes for the better. Okay? Your genes are highly dynamic. They turn on and turn off. It's like light switches. So just because you have a gene doesn't mean it's your destiny. You can do your part to turn things on and off. And we know that exercise turns on great things. And we know that being sedentary turns on bad things. So your disease is not inevitable. This is what you're led to believe. This is what we've been taught. You're powerless. This is what I thought. I mean, I had heartburn. I was on Nexium. I was on all these allergy medicines. I know I had arthritis all the time. I was on the newest, greatest Vioxx, which is now off the market because it causes heart issues. And so I was on all these medicines. I was living life through better science as a doctor. And because I was like, there's nothing I can do. My dad's got heartburn, is what I said. Well, he's got heartburn. I got a little bit of a hiatal hernia, and I've got allergies. I've always had allergies. I'm just the way it is. I've got to get used to it. And, I've got an irritable bowel syndrome, and that's just the way it is. I can't ever predict it. And I had this litany of things that were wrong with me because I truly believed I was powerless. And instead, and I thought, medicine, this is what we would have you believe. This guy, here we are, Yeah, that's not what we look like really, but so here we are. We're going to come save the day. We'll rescue you. That's real important to understand. Is that medicine? We're going to take care of you. It's that patriarchal. Trust us. We're going to take care of you, and that's not the case. Ultimately, you need to be your own superhero. Okay, this is important. It's about you. What decisions you're making. What can you do? With our guidance, we need to be here to guide you, to encourage you, to be your partner in health. Because you are not powerless, and we need to realize that, and you need to realize that. It's the best thing in the world to be sitting here at 45 and feel better than I did when I was 20. And that's the truth. I feel better, I'm more, it's an amazing thing, but and I'm not buying into the age thing. I know I'll have my diseases as I get older that I may not be able to pick up as much one day, but I'm not accepting that, I've got these diseases in my family, I'm just going to get them. I'm not going to do it. And I encourage you not to either. This is the thing, and y'all have heard me say this, if you've got an overflowing toilet, how many mops do you need? 1, 2, 3, 4, 5, How many mops do you need for that toilet? How many good plumbers do you need? Okay, so what we're selling right now is mops. There's water on the floor, guys. Oh, there's water on the floor. There's diabetes. There's fibromyalgia. There's rheumatoid arthritis. Oh, we've got this mop, and then we'll use this mop, and then we'll use this mop. All the while, the toilet's just overflowing. And that's really what's happening. I love that analogy because that's what's happening. We're not getting to the root cause. Let's fix the toilet, and all of a sudden we don't need mops anymore. The mop people ain't going to be happy about it. Okay? They're not going to like the idea that I'm not going to be able to sell mops anymore because there's a plumber in town. But that's what's happening. And this is functional medicine tree. And I don't want you to focus, it's a little bit busy. But at the bottom, you'll see things like the roots of the tree are sleep, exercise, nutrition, stress, relationships. And we'll talk about that more with Kara in the second hour. Trauma, microorganisms, environmental pollutants. And that leads up to genetic predisposition. And then that leads up to, signs and symptoms. And then you get to organ system diagnosis. And these things are on the outside. We really, we're cardiology, pulmonology, all of these things, these are all connected though. Everything is connected. And you can see part of my initial intake, this is my timeline. This is what my timeline looks like when I see somebody. And the problem with the timeline is that it takes time. I've got to understand everything that led up to this presentation. When somebody says they have fibromyalgia, what were the antecedents to that? What were the things that made this present? Because fibromyalgia is not a disease. It's a collection of symptoms. It's a collection of things. It's a collection of antecedents of I was not breastfed, and I had 5 antibiotics when I was younger, and by the way, I have irritable bowel syndrome, which would go along with leaky gut. When I eat these foods, I don't feel any better. So is it fibromyalgia, or is it because you have food sensitivities that are causing your immune system to attack you? I would say it's the latter. It's not fibromyalgia. It's an undiagnosed reason. But that may be because your gut started off behind the 8 ball. You were a C-section. But without a C-section, these people have a lot more increased risk of asthma. We have a lot more increased risk of colic because these kids are not getting the right bacteria in their gut. So we have to go back. But to get all of this and understand all of this, we have to understand time. And now I want to tell you, this is the way I look at medicine. Okay, this is a retirement chart. This has nothing to do with medicine. But you take Susan, who invests Chris invests $5,000 between 25 and 65. We've seen all these things, and he's going to make $1 million. So sooner Chris starts investing, the more money he's going to make in the long run, the better, right? And then we've got Bill. He comes in and he invests between 35 and 65. He doesn't invest as much, so he doesn't make as much as the end. Well, let's say that Bill, the little yellow line at the bottom, wants to make as much as as Chris. So the blue line, he wants to catch up to the blue line. He's going to have to put in more. So the later we wait to start investing, the more we have to put in. Okay? But you can't wait till you're 65 or 70 and all of a sudden go, okay, I'm going to quit smoking, I'm going to start exercising, I'm going to start eating right. You can still do it, but it's going to take a lot more effort. Okay? This is the problem with functional medicine, is that there is no magic pill, guys. There is no magic supplement. But if with enough hard work, and the later you start, the more you have to put in. You can't expect to make $1 million and start investing at 65 and I'll probably cut back 1 cigarette a day. I'll put $1 into my investment account and I'll make $1 million in 5 years. It's not going to happen. It's going to take a lot more. So it's a great way to think of it. It's like a health retirement account. Okay? So the more we put in now, the more we make in the long run. The longer we wait. And medicine, and the problem with functional medicine is it takes more money up front. Okay? To see me, it takes more time. And I ask that of my patients. I say it's going to be an annual membership fee to help me cover overhead, so I don't have to be a rat in the maze, running to algorithm to algorithm. And yes, it's going to take a little bit more up front. And traditional medicine says, we've got your insurance covered. Your medicine's going to be $5 to $10 a month. We've got it. But that person at 65, 75, and 80 is paying a lot more, and functional medicine makes a lot more sense. because now it makes a lot more sense to society. We're not costing society. We've got studies going on right now at Cleveland Clinic to show how much we do save society with disease, how much less testing we do. Because in the long run, that investment is a lot less out-of-pocket costs than traditional medicine. Most of our healthcare dollars is spent at end of life with chronic disease, okay? And your house and your kids' inheritance and other things are ate up with. So it's good to think of taking care of yourself as an investment, is what I'm trying to say, okay? So when we do this, yes, it takes more to see a functional medicine doc than a traditional doc, because we need time. We need time to put the puzzle together. And guess what? There was one guy who came and see me, hadn't worked in a year. And he said, Doc, he said, I don't have much, but he said, I have got to get back to work. I'm going to invest in you and me creating a partnership. He left, came back 3 months later. He said, I've worked more in the last 2 months than I have in the previous year. It was the best investment I ever made. And it really sank home with me that this guy was willing to invest in his health. And then all of a sudden he was able to work again. And so these are the kind of things that kind of bring it home to me, is that as we put our priorities where they need to be, which is us, and quit worrying about what kind of TV we got or our cell phone or our car. You know, a lot of people pay $2,000 or $3,000 for a new sunroof in their car, but they're going to balk when they have to buy gluten-free or they have to eat more organic foods. You know, they just don't make sense. Invest in yourself, not in things. Don't be a diagnosis. If I take anything away from this, don't be a diagnosis. Don't start living that, but instead be the self-reliant superhero you want to be. Okay. Thank you all, and we'll take a break, and then we'll see you on the second hour.